Good evening everyone, my name is Shubham Sunil Banda. My today's topic is about medical coding classifications. Medical coding classification systems are a group of the codes that correspond to individual procedure and the diagnosis. They are used to accurately track the information about the disease and the health condition in the patient record and play a role in a medical billing process. Medical coding classification systems are not used only by the hospitals and the care facilities. Government health programs such as Medicare and private insurer also use them for the variety of purposes, including statistical analysis of the disease and the procedure, claim and reimbursement, then the tracking outbreak and with the decision of the support system. Then there are five medical coding systems are classified. First one was ICD-11, second one is ICD-10-CM, third one is ICD-10-PCS, the fourth one is CPT, and the last one is SCP-CES level 2. Then in ICD-11 is the latest revision of the international classification disease and intended to replace the ICD-10 as the new global standard of the diagnostic code. ICD-11 went into use in January 2022 and is used to meticulous the classification everything from the diseases to various symptoms. It also recodified and classification area of some diseases, expand the definition of the sexual health and including the new entries of the human system and a sleep-wake disorder also among a new diagnosis. Then ICD-10-CM. The ICD-10-CM is the clinical modification of CM of the previous version of ICD-10. This version of ICD is designed to be used in a clinical setting and the content are modified to achieve a level of detail that meets the reporting need within the United States. ICD-10-CM also differ from the standard ICD-10 codes compared to ICD-10-CM. The medical code is ICD-10-CM are more detailed and are specially useful for a clinical outpatient and application because they allow the clarification about the severity of the diseases and conditions. Then the ICD-10-PCS. ICD-10-PCS is a procedural focused version of ICD and ICD-10. Unlike the ICD-10-CM, which is meant for the more detailed classification of diseases and conditions, the ICD-10-PCS contain more detailed medical codes for the procedure and equipments that is used in an inpatient setting. Then CPT stands for the current procedural terminology and is used to report the diagnostics, surgical and the medical procedure to relate the parties. CPT is the procedural medical coding classification system, meaning that it identifies the procedure that doctors and the care provider perform to help their patients. It is primary purpose is to communicate their procedure in a standardized way to administrative and the analytical uses. Then SCP-CES level 2. The Healthcare Common Procedure Coding System level 2 or SCP-CES is based on the CPT. SCP-CES codes are used to delineate and non-physician services that are not included in the CPT jurisprudence and such as the ambulances, drugs and the prosthetics. These are such a classifications of the ICD medical coding system. Thank you so much.